Hi everyone, and welcome to the NG Podcast. I'm Marcus, your host. In the NG Podcast, we hope to bring you content that's of interest to anyone involved in enteral feeding, whether you're a healthcare professional, a patient, or a carer. We hope you enjoy this episode, and if you do, please subscribe or like on whichever platform you're either viewing or listening to this on. Here we go. This week, we continue our partnership with PINNT, the leading charity for people using artificial nutrition. And it's part of their Talk About Han home artificial nutrition campaign. I'm delighted to welcome Leanne Goodlad, who is 22 years old and from the Shetland Islands. She's a university student studying for a law degree at Dundee University, and she just got back from uni, from shipping stuff back yesterday. Leanne's been using enteral feeding through a nasogastric and then a nasojejunal tube since 2019. Leanne, welcome to the NG Podcast. Thank you for taking the time to come on.
No worries. Thank you for having me on.
You are most welcome. You are the youngest PINT member we've had on the NG Podcast. I don't know, you may actually be the youngest PINT member. So can you tell me a little bit about how you came to be on enteral feeding?
Yeah, it's kind of a complex story. So I have a condition called Ehlers-Danlos syndrome, and I was diagnosed with that when I was very young. I was in primary school, and they realised I wasn't really developing my muscles properly. So I was in and out of physio and treatments, and they got me diagnosed with that over 10 years ago, 15 years ago. And then that was okay. I sort of accepted that I had this condition that could affect anything in my body because I had grown up with it, and it didn't sort of take on board how that would work. So I grew up with a lot of joint and muscle pains and dislocations and stiffness and headaches. And then when I got to university, I was in my second year, and I started flaring with Crohn's disease, which hadn't been diagnosed. So I was in that flare with Crohn's for nearly a year, and we couldn't really tone it down. It wasn't responding to steroids properly. I was just really, really unwell for that whole year. And then it came to the end of the steroid taper, which I had been on for 8 months. And I started getting unwell in a different way. So I was being sick all the time. I wasn't really managing to hold down water or any liquids. So I went into hospital, and they basically kept me in for 7 weeks. And they were like, oh, you've got gastroparesis as well, and your stomach's paralyzed. You're not actually able to manage anything orally at the moment. So we're going to send you home on a feeding tube. So that was how I got the feeding tube. And it's sort of just become part of my life. Like it's just another thing I do, and the way I eat it's just there.
So I mean, as is often the case, there's a long history before you actually end up on enteral feeding. Not quite as long as Don Colley, who we spoke to a few weeks ago, who sort of started at age 14 and actually ended up enterally feeding at 86. But still, you know, quite a long progression to it. So you've been using nasogastric and NJ tubes now for 18 months. Is it the plan for you to use nasal tubes long term?
No, that was never the plan. The plan was a temporary nasal tube, and that's why I left hospital on a nasogastric tube to then be assessed for a nasojejunal. And then obviously coronavirus hit. So I was on the nasogastric tube for about 6 months longer than I was supposed to be in the first place. And I've been on the NJ tube for a much, much longer time than was ever planned. The plan is to do a surgical tube so that I can maintain my nutrition a lot easier and a little bit more discreetly because obviously with being so young, it's quite difficult when you have all these funny looks because you've got a tube on your face. So I'm really looking forward to the surgical tube once I get it. But when that is, we've got no idea. It was planned for this summer, but that's been delayed again.
Yeah. So I guess a lot of things have been delayed by coronavirus. But so what's it like using an NG all the time? I know you kind of said, you've just sort of fitted it into your life, but what is it like? And are there any issues that that actually you do feel are an issue?
Yeah, I mean, I think a lot of people with feeding tubes and any sort of medical device will sort of take it on board and just be like, oh, it's just this thing I live with, even if it takes them a little while to reach that point. So for me, when I first started on feeding tubes, it was a really, really scary thing. I didn't really want to do it. And I relied a lot on my mum to sort of encourage me to like put on my feed and do my medicines and do everything normally, which is quite difficult because I was a university student and I had to come home and would kind of be babied again. So that was weird. But then I hit the point where I did get into the flow with it and I did start doing it myself. And I did sort of just take it in my stride a little bit. And it became a little bit easier. But it's easier because I'm used to it, but there's still quite a few complications that come from it. So because of my condition, when I was on the nasogastric tube into my stomach, I wasn't able to hold down my feed. So I was being sick quite a lot. So then I would throw up the feeding tubes and then I would have to replace them. And that's quite a weird experience when you're like quite young and you're trying to put this tube in your own throat, and it's really weird. So I was doing that for most of the first coronavirus lockdown. So that was horrible. And I don't think a lot of people understand how weird that experience can be of like putting in a feeding tube. Especially when you're in hospital and like the doctors and nurses will just be like, oh yeah, we're putting in a feeding tube. Like, don't worry, it's fine. A lot of people will just like blind panic at that. So yeah, I have quite a lot of feelings about putting in feeding tubes, and it sort of affects when I go into hospital for my placement of my nasojejunal tubes as well. So the last time I went into hospital to get it replaced, I apparently kicked the doctor when I was sedated. So it's quite embarrassing because that's not the type of person I am at all. And it was a doctor who it was a hospital that knew me and had dealt with me for quite a while. And they were like, oh yeah, you were really weird when you were sedated. And I was like, I'm so sorry. I didn't mean to do anything like that. But yeah, it can sometimes result in things like that. And then obviously like trying to live with it on the day to day, I get quite irritated throats and my skin's irritated as well. I've ended up with like pressure sores from the feeding tube. It's causing quite a lot of issues with like reflux and stuff. So it's quite difficult to try and manage those symptoms as well. It's just there's always like a balance towards things, and I had to sort of adjust to the new symptoms that the tube were giving me before I could sort of accept that I needed to have those symptoms to get a little bit better. So yeah, it's always just like balancing everything up, really.
Yeah. Well, I mean, that doctor, it's probably just some law of karma working that, he hadn't done anything awful to you, but maybe somebody else. So you got to kick him in the face. But it must be a bit of a shock when you wake up and somebody does tell you that.
Yeah. And when they're like, we had to give you extra sedation because you weren't responding to things properly. And I was like, oh, I'm so sorry. It's like, it's embarrassing. It's you just feel so bad. It's just awful. But yeah, it's I think it's one of those things that people don't really speak about, is how bad like placements can be for people. especially when you've had to do so many of them, and it's just not a nice procedure to have to constantly be doing and redoing. And
No.
especially for me, with my condition, knowing that there is a huge likelihood that I'm going to be sick and then I'm going to lose the tube, so I'm going to have to do it again all over again. It can really affect people, and thankfully I'm sort of over that stage now because it's been so long with it. But I know quite a few people who are on enteral nutrition who do still feel that way, and it's quite sad. Yeah.
When you were putting them down yourself, did you have to do all the pH testing and everything like that as well when you'd done it?
Yeah. So that was a weird experience. I would pH test and I would flush water, and I basically became my own little NAS because we were living through the pandemic, and because I live in such a small place, the hospital is quite rural, and it would mean I would have to go to A&E to get an NG tube placed. So they were just like, yeah, we'll just train you up on how to do it yourself. So I had to do quite a few tube replacements during those months of the pandemic.
Yeah. And you did mention briefly previously about, one of the other things about having the feeding tube, you're a young woman with a nasal tube, and I think you've had some sort of reactions that people judge why that might be.
Yeah, it's quite difficult to try and get people to understand that the feeding tube is there because it has to be. Even in public, if I go on to a bus or if I go into a restaurant, people will turn and stare. It's just, I think it's quite natural for people to look at something that's different. But it makes me quite self-conscious because I never wanted that sort of attention. I never asked for people to look at me. I don't do anything out of the ordinary for people to look at me. And people just look and stare. I've had like friends of friends come up to me and be like, oh, why do you have the tube? Is there anything that we can do? And then especially when it's like social events or eating, if I go out to a restaurant, people will think that I don't want to eat the food, or they'll assume what my condition is, which is really, I think it's quite inappropriate for strangers to sort of assume that I have a completely different condition and that I choose to be this way in some cases. It's a really weird thing to try and make the public understand that actually this is actually because of a medical condition anyway, but it's not for you to understand what my condition is. It's not for you to ask me what my condition is. It's not for you. It's for my medical team. So it's quite weird going out in public as someone my age with a feeding tube on my face.
You said that you currently trying to move to overnight feeds. Are you hoping that you'll feel less encumbered when you go out and about, if you can get to that? Because obviously the 20-hour feeds, you're carrying a pump with you all the time.
Yeah, absolutely. So I was on 20-hour feeds and then I reduced down to like 17-hour feeds. It's all sort of like management of my symptoms as they come. So if I have a bad day, I run at 17 hours a day. If I have a bad day, I run at 20 hours a day. If I have a good day, I run at 17 hours a day. I try and reduce that if I can. My dietitian wants me to try night feeds, which I want to try night feeds as well, because having a massive backpack on my back with a litre of fluid in it isn't really the best, especially because you factor in my condition, which causes dislocations and everything. I can't really carry that weight anyway. So I've spent the past year sort of out of work. I did have a job that I wanted to go back to, but because I would be having that feeding tube on my back all the time, it was a bit impossible for me to do, just because I wouldn't be able to carry that weight. So I'm really looking forward to potentially reaching the point where I don't have to have that backpack on all the time, because it's really awkward as well when strangers will like grab it off you, and like when you're getting in a taxi and they'll just like, oh, I'll take that bag, and you're like, no, that's on me, please don't.
yeah, it's connected.
Yeah.
You'll get a lot more than you were thinking you were going to get if you pull that. No, so that was I guess, was that a job while you were at uni that you were doing?
Yeah, it was actually, so I've got a job at uni that I do where I support first year students who live in residences. I've been quite lucky this year in that it's been completely online, so I haven't had to go into people's flats and try and speak to them and support them in their issues. So that's a job I could do from home pretty much. But when I was on my medical leave from university, I wanted to go back to my job in a supermarket. And then the timing of my feed and also the pandemic hitting meant that I couldn't go back to that job that I had been doing since I was 16. So it was quite a weird experience being at home with nothing really to do, especially just because there was the pandemic as well. And I was more vulnerable to the pandemic because I am on immunosuppressants. So it was just a really, really weird time full of like anxiety and not really having the same support and treatment as I would before. So it's just been such a weird few months and a really weird time to try and adjust to enteral feeding as well.
Absolutely. You kind of ended up with the perfect storm, I guess, because most of the time people wouldn't have to put their own tubes down. And I guess there's so much more precautions around you going in and having an NJ changed than there would be. You're probably one of the few people that's probably looking forward to a surgical tube because of how much better it potentially is.
Yeah, I think it's a really weird place to be, because I actually really don't want a surgical tube. It's always something that I actually pushed back on when my dietitian was speaking to me when I first came home and we were speaking about surgical tubes. I was just like, no, I'm fine with the nasal ones. Like, I don't want that. It's a very, very scary concept to take on. But when I weigh up the constant like throat pain and the ear pain and I've had little blisters at the back of my throat and mouth, and it's just, it reaches a point where sometimes you just can't keep going with something. And at this point I am really just waiting for that letter that comes in that says we've got an appointment date for your surgical tube, because it's so much hassle and stress trying to keep going with this tube. I mean, this tube that I've got in right now has been in for since October, so it's been in for quite a big chunk of time, just because we can't book in like a change. My hospital is quite small, so they don't do NJ changes, so I would have to be flown away to a hospital on the mainland anyway. But it's just, with the timing of everything, it's so difficult to organize those things. So this tube's been in for quite a while, and because of that I'm getting a lot more of the throat pain and the irritation than I would if it was like a short-term tube. But
well done you for keeping it going for that long. And you must be doing what you're supposed to do, because it hasn't blocked, and it's so just well done on that. You definitely are your own nurse. I think any nurse would be proud of keeping an NJ tube going for that long.
Yeah, I think I'm quite lucky. It's meant that I had to be a lot stricter with myself with trying oral food, because obviously I can try a little bit, but it's so unpredictable that I don't know what's going to happen when I do. So it really has meant that I've had to stick strictly to the dietitian guidance, which is quite hard to do as well when you're trying to adjust to a diet that means you're really not fitting in at all. And especially, like, I love food and I love eating. So not being able to do that and then only being able to try a little bit, it's actually really, really upsetting. I really hate food waste as well. So if I order a bit of food and then I can only manage like a quarter of the plate, which is so much less than I used to be able to eat, it's really, really upsetting, and it's quite difficult to deal with.
Yeah, and I mean, I think that's one of the things that everyone we've spoken to has talked about, and I guess, you know, student social life tends to revolve around food and maybe a little drink, but are there specific things, you know? Does it feel worse at Christmas and you know, the big family events? Because one of the issues is all celebrations tend to focus around food. Does that make it harder?
Yeah, definitely. And 100% on the student aspect of things. Even professional development events at university often revolve around networking drinks and networking nibbles and stuff. And it's really difficult when I want to go to those events, but if I partake in the eating or the drinking, I might end up being unwell. So that in itself is a really, really difficult barrier to university life. But also for family events and celebrations, it's so difficult to try and exist at Christmas time and exist at Easter and everything. I have 3 younger sisters, so and the youngest one is 4. So we still do the massive Christmas events and the massive Easter hunts and stuff. And I couldn't take part in Easter. I didn't buy myself an Easter egg. I didn't get given many Easter eggs. So that in itself was difficult. But then Christmas as well, it's like Christmas is an event that you want to take part in. So it's one of those things that I will. Back then as well, when I was still on the 20-hour feeds, it was one of the events that I did just say, no, I'm going to try a little bit of food, which it's quite difficult because you have to weigh up your condition and whether or not you want to be unwell, and also how much you want to partake in that celebration. So it's really, really weird, especially because when I left hospital in 2019, the only reason we left hospital was for Christmas. It was the lead up to Christmas when we left. So I was like, I need to go home for Christmas. Like, I just want to go home. And my mum asked the doctors, is she going to manage like pigs and blankets? Like, what's she going to do? And they were like, no, at this level, probably not. So that Christmas, they were basically saying, do not have any Christmas dinner. And when you get told that, and when someone else takes that away from you, it's really, really difficult to try and do that whole celebration and sit through the gifts and everything when you're being told you can't actually have any of this. So it's not the nicest. And I feel like this past year as well, when it hit the year anniversary of me being on enteral feeding, that was a huge struggle. And I don't really know why it hit me so much, but I literally counted down the days until the day I went into hospital. And I was like, well, that's a year of my life gone. And it's really weird because it's not a year of my life gone at all. It's like a year of my life that I was kind of gifted in a way, because my feeding tube helped me stay healthy enough to enjoy things. But yeah, it was just a really weird anniversary because I was just so affected by what had happened to me. And I was also like mourning as well in a way, like mourning my ability to eat food normally and mourning that year that had been taken. And even though the year wasn't taken, I'm graduating later than all my friends are, and I haven't really seen many people, and then the pandemic hit, so I haven't been able to see anyone anyway. So it was such a difficult little time, I think.
Yeah, it sort of affected everything all at once, and then a pandemic. You know, it would have been tough enough without the pandemic. So you're saying about graduating a year later. Are you going back to uni in September?
Yeah, so I actually went back this past year. I had already started a couple of months of my third year when I got unwell, and that's when I realised, actually, no, you're not going to push yourself through this year when you're so unwell. And then that decision was made for me when I went into hospital, and I was there for 7 weeks anyway. But I took that year out. So I've come back this year for my third year. And then next year I'm doing a fourth year. So that's when I finish my degree, is after an extra year. But everyone I know has graduated this year. So I'm sort of on my own in a way, with a completely different experience from other people. Plus, add in that university's been online this semester, and I haven't actually met anyone in the year that I'm now in. It's very, very weird. So, I have gone back, but I was only on campus for one semester. I've been doing uni from home since December.
And one of the things that we sort of asking everybody really is, like I said at the beginning, you may be the youngest member of PINNT. And obviously we're doing this as part of one of their campaigns to help people explain the impact artificial feeding has on their life. How has PINNT helped you since you've been a member?
Yeah, I think PINNT's one of those charities that everyone can sort of join up to. It's not necessarily bracketed into one age group. So I know there's young children in PINNT, but there isn't really anyone that I've met around my age who I know either online or in person. I mean, obviously I live in a very, very small place. So I'm one of the few people on enteral nutrition where I live. We're all dealt with under a small dietitian team. We don't have gastroenterologists where I live. It's all done through mainland services. So I don't really have access to other people who understand the difficulties of living with enteral nutrition. I'm quite lucky in that the dietitians are amazing little people. They do so much, and they understand that it's just one part of the whole life. But I don't get to speak through my worries about anything without that person being my dietitian. So PINNT has been really useful for introducing me to a whole community of people who are in the same sort of boat. And it's so refreshing to be able to be in a group that has such a variety of ages. Because obviously enteral nutrition is sometimes seen as end-of-life care or cancer care or all these different sort of assumptions. And obviously for me, enteral nutrition is so key in keeping me alive, but I don't see it as end-of-life care because I'm 22 and I'm not about to leave at any time soon. So it's really good for me to be able to speak about everything that's going on with so many different people from all walks of life, and get all their opinions on things as well. It's nice having a different take on things. And I would also say that, especially when it hit the year anniversary of me being unwell, when I was going through quite a bit of stress as well, I would say that PINNT was really, really good to speak to, just to be like, I'm struggling with putting my feed on, or I'm struggling with being upset about being on feed. And it was really useful to just hear from them, like, yeah, we all have that sort of time, but we work through it. And it was nice to hear that, rather than speaking to like a professional who would be like, oh, we need to get you like specific help and support from a medical facility, because that wouldn't have been any use. It was just nice to have a down-to-earth conversation with normal people. So yeah, I really appreciate being in PINNT and being able to speak to other people.
Yeah. No, I have to say that, my experience of PINNT is really exactly that. You've got such a wide age range of people who have enteral feed or even PN as well, for such a wide variety of reasons. And I think one of the real privileges of doing this series with PINNT has been hearing how different people get on with their lives and find ways round the issues, like you have, but it just feels like a really close community, of people who are members, and everybody seems so willing to help each other.
Yeah, definitely. And I think as well, because it's not boxed into one condition, you don't have to explain yourself. You don't have to, like, if you're in, like, for instance, like a group for a specific condition, you'd have to be like, these are my symptoms at the moment. Like, how has everyone else been with these symptoms? Whereas in PINNT, you can just be like, oh yeah, I have an NG tube, or I have a peg. Like, how's everything been? Like, it's so nice not to have to explain yourself constantly and justify the conditions that you've got. And it's honestly, I think it's quite unique in the sense that we really do sort of come together, because it's enteral nutrition and PN as well. It's not the nicest thing to live with, especially because you have all these opinions and from people in the public and also in the medical profession who are like, oh, well, you must be coming to the end of your life, or you must have a specific condition that I don't really want to deal with. It's just so nice being able to just have that conversation with someone who's a normal, everyday person. Like, you could come across someone from PINNT on the street, and that's so important to me, because sometimes you're just not feeling the need to talk to a medical professional and have all the jargon thrown at you and everything. It's just nice being able to talk about everything with someone else. Yeah.
Well, listen, we've come to the end of our time today. Thank you so much for coming on and sharing your experiences of, what is now long-term nasal tube feeding and how you're working with it to continue your studies. I really do wish you all the best for the future, and please keep in touch. Maybe come back when you've graduated and tell us what that last year was. But it's been a real pleasure having you on, Leanne. So thanks so much for taking the time.
No, thank you. Honestly, it's been amazing speaking to you. Thanks so much.
Okay. See you soon.
Yeah. Bye.
Bye.